not about bioremodeling, but about a new kind of biostimulation, because today we are a lot of words that define this kind of procedure. Bioamplification, bioremodeling, biostimulation, biorestructuration. But it's not important the name, it's important what we inject, where we inject, how to inject. So it's a more wide procedure if we talk to the past, that at the beginning the biostimulation was introduced to make a biostimulation to the fibroblasts to induce to the production of a new collagen. Today is a little bit different. They are new concept. So the biostimulation is not only that involve the fibroblasts and the collagen, but involve also other cell lines and other structures. So for this reason, we tried with the new formulas. We try to make a new target. Okay, not only fibroblasts, but also all other cell lines. For example, muscles, myocyte, or for example, the corneocyte. Okay, that all are involved on the aging phase. There is not a product for season. Okay, the physician must choose the right product for the right person. Okay, it must be very personalized therapy. But for what I prefer, I use my formula, formula that inside you can find the anti-aging product molecule. They are scavengers, anti-free radicals, and they reduce the aging process. With this part of the formula, we find also the other molecules that they induce the production of the fibroblasts to new collagen type 3. Is the young collagen, it's not the fibrotic. We try to be selective and involve the production only of type 3. For this reason, we use almost the low weight molecular of the low weight of the hyaluronic acid, for example, or we use peptide or amino acid. We use also for other molecular to induce an hydration. And in this case, we can use high weight hyaluronic acid or mannitolo and others and other things. At the end, we find also inside the formula products that enhance a results, okay, aesthetic outcome. So for this reason, we add it in different part, different area, different molecules that make enhance. For example, the reduction of the fine wrinkles, for example, or to reduce the elastosis, or to reduce for example, the skin laxity. It's important to understand how to use, because in a different part you have to use in different layer, and you have to make a stimulation of a different part of the tissue. For example, on the lower third and the middle third of the face, we have to enhance the superficial fat layer, the superficial soft tissue. If we go on the periocular area, in the periorbicular area, we have to enhance the derma, the reticular derma and the deep derma. Or if you go on the forehead, on the neck, we have to be on a middle layer, because we have to reduce the wrinkles, the mimic wrinkles, and the skin laxity. Advantage is that if you choose the right this product, this complex product, in the right way, you will have a good results for the patient. and doctors will have a more benefit to use for further procedures. For example, after to do the filler or to do the botulinum toxin or other corrective procedure. Because the answer is come from the market, okay? Because patient today request every day more smart procedure with no downtime, with very fast recovery, with very easy procedure, and also is important the price with no very expensive, and also the procedure must be modulable. So you have to see step by step how is the changing, and it must be durable but also reversible. So because at today what you need today that you have 30 years old, for example, is not like you will need and when you will have 60 years old. So for this reason, the aesthetic medicine must be near quickly the age. Okay, it's not for to be more younger, but to have an age with the good aspect.